I had the best nurses. They took really good care of me. One even got me Dunkin' Donut pod coffee. She was so sweet. She went and found me some coffee, and she said, I even got Dunkin', look at this. They kept me up on my medicines that I take every day. I didn't have to worry about that. Didn't have to worry about bringing them from home. They were here. They were ready. They were so chipper all through, you know, the 24-hour cycle. Even in the nighttime, they were still chipper. And when I was up, they were talking with me, and they kept saying, "I can't believe how well you're doing. I cannot believe how well you're doing." And it was just, they were so sweet, so very sweet. The physical therapy group, they were doll babies, trying to make sure I had everything I needed to take home, that I had my exercise sheet so that I knew what I was doing at home, trying to make sure that I got my PT and all of that stuff, and that I knew how to be cautious, you know, not overdo, because I have a tendency to do that, which is probably why I was without even a cane after my 6-week checkup, or at my 6-week checkup after the second surgery. And my doctor was he was looking at me walk across, and he was like, "You don't have anything with you." As I was walking across the office going from my exam room to x-ray to get a picture to make sure everything was as it should be. So yeah, I was rocking and rolling, and I'm even rocking and rolling still.